Well, thank you, and thank you for that nice pitch, Sonia, before, because this is an important subject that's a bit undervalued in the United States. The most common headache out there by far is a tension headache, by far. But they are, by definition, mild. People self-treat, and I've been doing headache medicine since 1978, and if I've seen 3 people with tension headaches, it's probably a lot. So these are not a problem that bring people to a doctor. It turns out, if you go to a doctor with a complaint of headache, 94% of the time you have migraine. And that's kind of a funny number, but what you need to remember is that migraine is simply a phenotype, and it's probably due to thousands of different genotypes, perhaps with their own stories. Now, it's undervalued in the US. The WHO certainly doesn't believe that at all. In fact, in this global burden of disease study, it was found to be the 6th highest cause worldwide of disability. Headache collectively was the 3rd highest, but migraine number 6. That's a pretty amazing statistic. Now, we find a lot of abnormalities in people with migraine. For example, if you are a doctor and you make a serious mistake, like you order an MRI scan on them, you often find a whole bunch of white dots, and the significance of these white dots is very unclear. We know that progenitor cells, which are involved in endothelial healing, they're reduced in people with migraine. So it appears that people with migraine have less ability to heal diseased blood vessels. That may be a problem as well. This was really scary, published just in 2013, and it has to do with women with migraine with aura. And it turns out, and I think we all learned in medical school, what things are bad for you in terms of a risk factor for stroke. Well, guess what? If you have migraine with aura, you have a higher risk of stroke than if you have diabetes, malignant hypertension, you're morbidly obese, you have a family history of MI, and you're a smoker. The number one we've identified so far as a trigger for stroke in women with aura. So what's migraine? There's a lot of things that migraine does and a lot of symptoms that it has. And if you have migraine, you know darn well that it's a lot more complicated than just a headache. Fact is that all sorts of systems in the body shut down. What is migraine? And even though there are 5,000 genotypes, obviously I'm making that number up, what does migraine have in common? Why do we call migraine migraine? And we think perhaps the answer is this. This is a wave that was identified more than 70 years ago by a then young graduate student at Harvard University named Liao. And Liao put excitatory amino acids on the cortex of rabbits, and a wave occurred which spread across the cortex at 3 millimeters a minute, and behind it left neurons in a refractory period. We call this cortical spreading depression, and this may be the final common pathway, however genetically you develop migraine. And we know that blood flow is abnormal, and I learned in school that migraine was a vascular headache, and we learned all about blood flow. The blood flow problems are probably secondary to what's going on in migraine and probably follow that wave. And we know that there's a wave of impaired blood and increased blood, which moves across the brain as well. And it doesn't seem to matter whether you have migraine with aura or without aura, you probably still get that wave. The ones which we know about most genetically are 3 forms, which are called familial hemiplegic migraine, where people and families develop paralysis. And turns out that the 3 types of hemiplegic migraine all have different biology. And the first type and the third type have to do with neurons, which shouldn't shock you. Neurons, after all, are the excitatory nerves. I mean, that's what sort of, we all learn are the excitatory cells in the body. But astrocytes, I learned in medical school, were kind of styrofoam peanuts. And they taught me that astrocytes just kind of held the neurons up there and didn't do much else. Well, it turns out that the second form of familial hemiplegic migraine has to do with astrocytes and absolutely nothing to do with neurons whatsoever. I also learned in med school that blood vessels carry blood. And I still think that's probably true. But it turns out that these endothelial cells are probably also involved in migraine as well, and they communicate with each other. They talk to astrocytes and perhaps talk to neurons. So we've come to learn that these cells are actually communicating in the brain as well as neurons and astrocytes. So we think the final common pathway is cortical spreading depression. And people with migraine inherit this kind of hyperexcitable brain, which may have some evolutionary advantages, incidentally, although it's hard to convince my patients how lucky they are that they have migraine. But what happens is that the meninges become excited, a group of chemicals up-diffuse into the meninges, excitatory amino acids, nitric oxide, calcitonin, gene-related peptide. They cause sensation, through the trigeminal nerve activation and back up into the brain. And you have this kind of nasty arc that occurs in someone with migraine. So we're trying to learn how can you kind of calm down this hyperexcitable nervous system in some way without cognitively or in other ways impairing a person. Thank you.